Hi, today we will learn about tetracyclines.
Today, we'll explore the fascinating world of tetracycline, a powerful antibiotic. Tetracycline belongs to the tetracycline class of antibiotics. This class serves as a broad-spectrum bacteriostatic agent. Essentially, it slows down or stops the growth of bacteria without killing them outright. Let's start with its unique structure. Tetracycline is a polyketide antibiotic derived from Streptomyces species. Its core consists of 4 fused hydrocarbon rings, giving tetracycline its name. Next, let's examine how it works. Tetracycline targets the 30S ribosomal subunit of bacteria. It binds reversibly to this subunit. This action prevents the attachment of amino acyl trunner to the mRNA ribosome complex. Consequently, protein synthesis is inhibited, and bacterial growth stops. In terms of effectiveness, tetracycline is a broad-spectrum antibiotic. It works against both gram-positive and gram-negative bacteria. It is also effective against rickettsia, chlamydia, mycoplasma, Borrelia, the cause of Lyme disease, and Vibrio cholerae. Now, let's discuss its pharmacokinetics. Tetracycline is well absorbed when taken orally. However, its absorption can be reduced by food, milk, and antacids due to chelation with calcium, magnesium, iron, and aluminium. It is widely distributed in the body, crossing the placenta, and entering breast milk. Tetracycline undergoes minimal metabolism, and is mainly excreted in urine. Tetracycline has various therapeutic uses. It treats respiratory infections, such as those caused by Mycoplasma pneumoniae. It is also effective for rickettsial infections, sexually transmitted infections, skin conditions like acne, zoonotic infections, and gastrointestinal infections. Despite its benefits, tetracycline can cause adverse effects. Commonly reported effects include gastrointestinal symptoms like nausea and diarrhea. It can also cause permanent teeth discoloration in children, hepatotoxicity during pregnancy, exacerbation of renal failure, photosensitivity reactions, and superinfections. Certain groups should avoid tetracycline. These include children under 8 years old, pregnant women, and individuals with renal impairments. Be cautious of drug interactions. The presence of milk, iron, magnesium, and aluminium can decrease tetracycline absorption. Additionally, using tetracycline with retinoids may increase toxicity, while it can reduce the efficacy of oral contraceptives. For safe use, there are some precautions to consider. Avoid sunlight due to the risk of photosensitivity. Take the medication on an empty stomach and with a full glass of water. And remember to steer clear of milk and antacids. In summary, tetracycline is a versatile antibiotic with a complex action mechanism. It targets various bacterial infections but comes with potential side effects and drug interactions. Ensure you consult a healthcare professional before using tetracycline. If you found this information helpful, please like and subscribe for more insights into pharmaceuticals and health.